Hi there, Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health in the Peoria Metro Center and our YouTube channel, Health and Horsepower. This week, I want to talk to you a little bit more about the winter blues or seasonal affective disorder. I feel like so many times as we get into the winter months where the daylight time is shorter and we have longer, darker night times, a lot of people end up having some issues with depression or mood instabilities that is going on. Now, when it comes to seasonal affective disorder versus winter blues, a lot of this has to do with number one, sunlight disappearing, but also some nutritional deficiencies. And sometimes I see a lot of issues with dietary changes, especially as we get into those holiday times when we're not eating the best or snacking on things that aren't necessarily the best for us or heavy for us. So a lot of times when it comes to winter blues, or like I said, more of that seasonal kind of mood change or up and down, we want to make sure that we are getting proper nutrition. So the biggest thing I recommend is making sure you're paying attention to your diet. There's an app that I absolutely love, 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 love. It's called Lifesum, Lifesum. It is an app that you can download. You can actually track not only your water intake, but what you're eating and also your exercise. And there's even a widget you can put on your phone to tap those in really easily. But you can actually track what you're eating, how much water you're getting, your exercise, so that you can really make sure you're staying on track. It'll even encourage you and check in with you as well. There is a free version that's available, and what I really love is it actually tracks your macros. So it tracks how many fats you're getting, it tracks how many carbs you're getting, it tracks how much protein you're getting in grams. So if we're looking at protein servings, a lot of people are not getting enough protein. Now, keep in mind, protein is what your body uses to rebuild your amino acids, your muscles, your neurotransmitters that all help with your mood and your hormones. So if you're not getting enough protein, that can actually cause issues with hormone imbalance and depression just by itself. So I usually recommend most adults get at least 75 grams of protein a day, up to 100. If you're working out, I usually say at least 100, maybe more than that, to make sure your body is getting enough protein coming in. Obviously, we want to be careful with fats. We want to aim for more of our healthy fats rather than the ones that are harder to digest and harder on our bodies and tend to cause issues with plaquing and things like that in our arteries. But biggest thing is making sure you're getting enough protein and regular meals throughout the day. Because if we're skipping meals, if we're doing intermittent fasting, which I am a big proponent of not doing intermittent fasting for women that are under stress or have hormone imbalance issues. A lot of women tend to have sugar balance and hormone balance issues going on at the same time. When you add intermittent fasting, it actually causes your hormones to get worse and actually feeds into that cycle of adrenal fatigue and adrenal damage that can cause HPA axis disorder. So make sure you're getting enough protein. If you are a woman that is under stress or has hormone balance issues, please don't do intermittent fasting, but make sure you're eating regular meals. Men do great with intermittent fasting. However, again, if they're under stress or have hormone balance issues, that could also be contraindicating for them not to do intermittent fasting. Really, when it comes down to it, you want to make sure that your body is getting the proper nutrition for itself. If you're on a limited ingredient diet, or if you have diabetes or you have other health concerns, you want to make sure you're working with a dietitian or a doctor, or a lot of times I can sit down with you, kind of go over what you're doing currently and what we can do to improve upon nutrition to make sure you're getting the right stuff in. You also want to make sure that you are taking vitamin D during the winter months. In the Midwest, we do not get enough sunlight exposure to make vitamin D, so you need to be taking it during the winter months. I usually recommend getting your vitamin D level tested kind of in the fall, winter, and then again in the spring to make sure you know where your levels are at. Normal range for vitamin D is like 30 to 100. I usually like to say you want to aim for like 45 to 50 as we get into winter. So if you're in the 30s, we might need to make sure you're taking enough or increase your dosage or even change the supplement type that you're taking. A lot of people take like over the pill or over the counter pill forms or prescription pill forms. And because vitamin D is fat soluble, their body has trouble like absorbing that. So I've had a few patients that were taking 50,000 units of vitamin D and their levels weren't increasing. As soon as we switched them to a liquid form that was in a fatty acid with the vitamin K1 and K2, their body started absorbing and changing those numbers to get them back in range. So usually, like I said, depending on where you're at, if you're in the 30s, I usually say we want to increase and retest in like 8 to 12 weeks to make sure we're in that 45-50. And then in the springtime, we want to retest. If you're already at 45-50, you want to do a maintenance dose throughout the winter to make sure you are good to go by the time we get through and get to spring, which I always feel like can't come soon enough. Like once January, February hits, I'm like, okay, I'm over it. I'm ready for spring. Let's go. Give me some sunlight. Another thing can be really helpful for that sunlight exposure is looking into like UV lights or vitamin D lights. They do have lights that you can purchase that go like on a desk, or it can be mounted on the wall next to you that you can have just going throughout the day so you're getting that sunlight exposure. Red light therapy can also be effective. You usually need to do a lot more red light therapy to get enough of that light exposure. I'm more of a big fan of the UV lights and also supplementation of vitamin D as well to help with that. But make sure you have the right nutrition and diet. Make sure you have the right supplementation. And if you're still having issues, there may be some emotional or mental components going on that could also be playing a part into that. It might be a good idea to talk with your doctor or talk with a therapist to make sure that you are doing everything possible to handle the mental and emotional component as you're working on the physical stuff too. If you have any questions or want to sit down with me to talk about how I can help assist you with this or guide you with that, please give my office a call, 309-689-6200, or go to our website, freedompeoria.org. There is a new patient tab. You can request an appointment, and we can do those in the office or virtually as well if you live in Illinois. So if you have any questions, I will talk to you later. Have a great rest of your day.